Hi, my name is Chantel Lender. I'm an RN student, and today I'm going to be demonstrating how to move a patient. So the first thing that we're going to do, we're going to state the first 5, which is wash your hands, identify your patient by at least 2 methods, provide for privacy, explain any procedures or interventions that will be performed, and ensure the safety of both the patient as well as the RN. So with patient movement, there are several different steps that we're going to do. Those steps include pulling a patient up in bed with assistance, supporting a patient in a supine position, supporting a patient in the lateral position, assisting a patient into a sitting position, transferring a patient from the bed to a chair, and ambulating a patient. So now we're going to backtrack and we're going to go through each of those sections piece by piece. So the first thing that we're going to do is assist a patient up in bed. This could happen if they were positioned and they kind of shuffled down a little bit and they need to be readjusted. So one of the first things that you're going to do, you're going to go and get the assistance of another healthcare worker. It cannot be a visitor to the hospital. It cannot be another patient or the patient themselves. So you're going to go out, get another healthcare worker to come in and assist you. You are then going to direct the healthcare worker how to assist you. Before you're going to move the patient, you're going to make sure that any call bells, IV tubing, or patient drains are safely out of the way. That way they're not getting yanked out or tugged on. And after that, you are going to make sure that you put a pillow up at the head of the bed to ensure that whenever you move the patient, they're not going to hit their head on anything. So after you have all of those things completed, my assistant would be on the other side. I would be on this side. We would use the draw sheet to move the patient up. We would go on the count of 3, 1, 2, 3, and then we would hoist them up together. So after pulling a patient up in bed, we would support the patient in a supine position. That entails supporting the patient's comfort and the patient's safety. If the patient's going to be in bed for a prolonged period of time, we want to make sure that we're watching out for pressure ulcers or any type of bed sores. So that means we have to rotate the patient occasionally if we have to place a pillow under legs or under their back, anything like that. We also want to make sure that the side rails are always up on the bed. After we support a patient in the supine position, we're going to support a patient in the lateral position. So whenever we are supporting a patient in the lateral position, there's a lot of pillow placement that we want to do. We're going to place a pillow underneath our patient's head to make sure that the head and neck are aligned with the trunk. We are going to take the patient's arm and we're going to lift it up a little bit because in the end we're going to be rolling the patient this way and we don't want them laying on their shoulder. So we've positioned the arm. Next, we're going to tuck a pillow underneath the upper arm. After we have a pillow tucked under the upper arm, we're going to place a pillow under the upper leg and thigh area to make sure that the extremities are parallel to the bed. And then we can place another pillow to help make sure that the right and left hips and shoulders are aligned. They're aligned in the same plane. So we need to do that. And then once we have all of our pillows placed, we are going to roll our patient towards us. So once we do that, my assistant again would be on the other side. I would be on this side where I'm going to place my hand. I'm going to be under the armpit a little bit and then above the popliteal space, and then my assistant, we would cross wrists whenever we're rolling the patient. So on the count of 3, 1, 2, 3, and we would roll the patient into the lateral position. Once the patient is in the lateral position, we would take a rolled up pillow and we could put it along their back. Next, we would move on to moving a patient into a sitting position at the edge of the bed. So the first thing that we are going to do is we are going to place our chair appropriately. So the chair that we're going to eventually move our patient to, we want to make sure that we have it nearby and we want to make sure that we have it in the appropriate position. We also have our gait belt ready for later whenever we need it. So after we have our chair positioned appropriately, we're going to move our patient into the lateral position, which our patient already is in the lateral position. We're going to make sure that the patient is at the edge of the bed. We're going to make sure that we are standing beside the patient, maintaining patient safety. We are going to assume our broad stance, and then we are going to place one arm around the patient's shoulders. And then we would place the other arm under the patient's thigh, kind of near the popliteal space, and then we would get them into a seated position. And we would have them sit. We would stay with them until they were well balanced. You may have to readjust the placement of your chair. So once our patient is well balanced, we're going to move on to transferring our patient from the bed to the chair. The first thing that we're going to do is we're going to assess our patient for orthostatic hypotension. Whenever we are assessing orthostatic hypotension, you want to take their blood pressure whenever they're laying supine, you want to take their blood pressure whenever they are sitting, and you want to take their blood pressure whenever they are standing. A significant drop in blood pressure is 20 millimeters of mercury for systolic and 10 millimeters of mercury for diastolic. So we have our patient sitting. We have them already assessed for orthostatic hypotension, and that's not going to be an issue. Next, we're going to apply our gait belt. Make sure that the gait belt is appropriately applied. After we have the gait belt applied, we are going to make sure that the patient has his feet flat on the floor. We would ask him which is his stronger foot, right or left.
Right.
Okay. So then we're going to instruct him. We're going to have him take his right foot and kind of place it under the bed a little bit and put his weaker foot forward. After we have his feet positioned appropriately, we're going to instruct the patient to use his hands to push up off of the bed. And we're going to make sure that we have a grip on the gait belt just in case he's unsteady. We're going to stand with him and make sure that he is steady. If he needs assistance with that, we will steady him. Then we're going to have him switch his weight from one foot to the other. Okay. And then we are going to we're going to pivot together towards the chair. And we can bring the chair closer if we need to. So we're going to pivot towards the chair. We would have the chair locked if it has locking devices on it. We're going to get the patient so that the backs of his legs are against the chair. I would then instruct him to use his hands to feel backwards. And then I'm going to stand directly in front of the patient. And then we're going to lower him down slowly into the chair using the gait belt. So once the patient is in the chair, then we could move on to ambulating the patient. With ambulating the patient, we are going to assist them. They're in the chair already. So once they're in the chair, we're going to assist them to stand up again. And we would do all the same stuff. The stronger foot back under the chair a little bit, weaker foot forward. Feet flat on the ground. Pushing off with our hands. Grabbing the gait belt to assist him up. We're going to stand up for a minute. At this point, I would move behind him because I'm going to be grasping the gait belt from behind. And whenever we start to ambulate, I'm going to be standing on his weaker side, behind him and slightly on the weaker side. And then we are going to start to, I'm going to encourage the patient to assume a normal stance. So back straight and head forward. And then we're actually going to ambulate. At his pace, whatever is comfortable. And then we would return to our chair. We would do the same method that we did before, pivoting, having him back up so that his legs are against the chair, reaching back for it, and then steadily being lowered down into the chair. Or into the bed, whichever the patient preferred. If they want to sit in their chair or if they want to go back into bed, it's their prerogative. After we've done that, I would need to wash my hands. After we have completed all of the patient movement, I would go and document in the patient's record everything that was done. Throughout the entire skill, I would support the concept of infection control. Throughout the entire skill, I would support the concept of patient safety. And throughout the entire skill, I would demonstrate proper body mechanics. And we are done with this skill.